Hello everyone. In this video, we will talk about medications used in cough, and like all other pharma videos, the video notes for this lecture will be available for free download from the app. So the cough reflex is a protective reflex which helps get rid of irritants in respiratory passages. In some diseases, however, excessive cough occurs, which can be either useful cough, where it helps to get rid of excessive mucus which is forming. That useful cough is also known as productive cough because of the production of the mucus which is moving out of the respiratory passages. And other cough may be useless cough, where it is dry cough, mucus is not being formed and it is just troublesome to the patient, and that is why it is also known as useless cough. So if this dry cough is excessive, it is very troublesome to the patient and it can even cause fatigue of respiratory muscles, and they will have difficulty in breathing as well because of this fatigue. So this cough should be stopped. So if we understand the cough reflex physiology, we can easily understand the medications used for cough. So here this diagram is showing the cough reflex, where we have this epithelial cells that is lining the airways, and these are supplied by certain afferent nerve fibers which include the A delta fibers and the C fibers. And these nerve fibers not only supply the lining of the airways, that is, these afferents are present in pharynx, larynx, airways, but they are also present in lung parenchyma. So cough can initiate from any of these places. Now, in the presence of irritants and inflammatory mediators, these afferents are stimulated. Irritants, basically mechanical stimulus, stimulates the A delta fibers, and the chemical mediators, they stimulate the C fibers. Information is taken from this afferents to the medulla, to nucleus tractus solitarius, and to the cough center, which initiates the cough. Now, on this airway passages, these epithelial cells, they also produce mucus, and the irritants get trapped in this mucus, and these epithelial cells, they have cilia on their membrane which move continuously, moving this mucus towards the mouth, towards the pharynx, and as it reaches towards the mouth, this mucus is swallowed. So that is about the cough reflex and the immune function which it provides, that is getting rid of the irritants, and also this mucociliary function gets rid of the trapped particles in this mucus. Now, what are the medications? Once we understand this cough reflex, we will be able to understand the medications. So the drugs for cough are broadly classified into expectorants and antitussives. Expectorants are basically also known as mucokinetics, which basically increase the movement of the mucus, as the name is suggesting, mucokinetics. So these expectorants increase secretion, and then there are mucolytics. The ones which increase secretion include the salts and guaifenesin. Now these salts, for example, ammonium chloride or hypertonic saline, which is used for inhalation, in nebulization, it is inhaled. So what happens that this hypertonic saline is basically going into the airway passages, and this is hypertonic. That means the osmolarity is more than that of the body fluid. So it is going to draw in water into the respiratory passages. So that is going to increase the secretion of the mucus. Then we have mucolytics. Mucolytics will basically break down the mucus, and these mucolytics include bromhexine, Ambroxol, acetylcysteine, carbocysteine, and dornase alpha. So let us see the mechanism of action of these mucolytics. But before we move into the mucolytics, let me just touch upon the pharyngeal demulcents. Pharyngeal demulcents are the substances that coat, soothe and protect the mucous membrane of the throat. So they basically reduce the irritation in the throat, and these some of these pharyngeal demulcents include like honey, linctus syrup, glycerine. These are pharyngeal demulcents which basically soothe the throat and reduce the irritation at the level of the pharynx. Okay. So moving on to the mechanism of action of mucolytics. So first is acetylcysteine and carbocysteine. See, mucus is basically formed by mucoproteins which have disulfide bonds connecting these mucoproteins. So these are the chains and these are connected by the disulfide bonds. So if we need to reduce the consistency of this mucus, we can use acetylcysteine and carbocysteine, which will break down this disulfide bonds, and this is going to decrease the consistency of the mucus. So when can these drugs be used? Well, in the patients in whom mucus consistency is thick, for example, in case of cystic fibrosis, in tracheostomy patients and asthmatic bronchitis. But remember, you have to have caution in peptic ulcer disease patients because these drugs, acetylcysteine and carbocysteine, can breach the gastric mucosal barrier. In fact, carbocysteine is contraindicated in peptic ulcer disease patient. Okay, so that is acetylcysteine and carbocysteine. Then we have the other drugs, that is bromhexine and ambroxol. Bromhexine and ambroxol, they also break down the mucus. They also stimulate the epithelial cells to secrete thin mucus. Okay, so break down mucus, secrete thin mucus, and these epithelial cells also release lysosomal enzymes, which in turn also cause the breakdown of the mucus. So there is direct breakdown of the mucus and indirect breakdown of the mucus because of the release of these lysosomal enzymes. Now, since this bromhexine and ambroxol are causing release of the mucus, there is secretion of thin mucus. So, similar are its side effects. That means they are increasing the secretion from the eyes, that is, there can be lacrimation, and also from the nose, that is, rhinorrhea. Then the other mucolytic is dornase alpha. Dornase alpha is used in cystic fibrosis. Again, it breaks down the mucus polysaccharide, thus decreasing the consistency of the mucus, right? So those were the mucolytics. Moving on to the next class of drugs, that is the antitussives. So antitussives are of two categories, that is opioids and non-opioids. In opioids, we have codeine, codeine, hydrocodone and morphine. Morphine, we will see morphine is not generally used. Other opioid antitussives are components of some cough syrup, but morphine is not generally used. Non-opioid antitussives include dextromethorphan, and then there are antihistaminics. Basically, these antitussives are the cough suppressant. Expectorants, we have seen that they decrease the consistency of the mucus. They are causing the mucus breakdown. So, they are helping the patient to remove the cough so that the energy which is required is lesser in removing that thick mucus. On the other hand, antitussives directly suppress the cough. So, how do they do that? So we have seen the cough reflex. Now these antitussives, both opioids and non-opioids, they basically suppress the cough at the level of the medulla. So opioid antitussives suppress the cough center, but their side effects include sedation, constipation, they have high abuse potential, and higher dose can lead to respiratory depression. Understanding. And this sedation, constipation, abuse potential and respiratory depression are common side effects of all opioids. Maybe when we will talk about opioids in analgesics, then we will talk about it in detail. But remember here that sedation, constipation, abuse potential and respiratory depression are common side effects of all opioids. Now, because of this respiratory depression, these opioids are contraindicated in all patients with lesser respiratory reserve. For example, they are contraindicated in patients of asthma, COPD, and they are also contraindicated in children and elderly, right? But they can be used in cough which are not controlled by other medications, fine. Then we have non-opioid antitussives, that is dextromethorphan. Dextromethorphan is found to be not very effective and has high abuse potential. Now KDT writes that it does not has abuse potential, but Goodman-Gilman writes that it has high abuse potential. So we'll stick with that dextromethorphan also has high abuse potential, and in high doses the side effects with dextromethorphan which can occur is hallucination. Now, apart from this opioids and non-opioid antitussives, we have the antihistaminics. Now, antihistaminics are mainly used for their sedation effect, and they do not suppress the cough directly. They basically sedate the patient. This is basically the first generation Antihistaminics, first generation H1 receptor blocker, which we have already studied in antihistaminics, they have this sedation effect. And apart from the sedation effect, they also have anticholinergic effect. And because of this, they can also decrease the secretion. So sometimes your patient, if you give these antihistaminics, which are commonly present in cough syrup, when these are given, they complain that they feel some choking sensation, like everything is blocked in their throat because of this decreased secretion. Now remember one thing here, that these antitussives you are using for non-productive cough, dry cough, and they should not be used when there is mucus production, because mucus has to be expectorated out. It should not be accumulated within the respiratory passages and the lungs. So in that conditions, we should not suppress the cough, right? So yeah, we talked about opioid, non-opioid and antihistaminics. Then we also have some other antitussives which include benzonatate and lidocaine. Both these drugs decrease the action potential in the afferent nerve. So basically they block the generation and conduction of action potential in the afferent nerves. So there will not be any cough. They are not acting centrally on the cough center. They are decreasing the action potential in the afferent nerves. But one thing you remember, that since they are kind of numbing the local area, so with lidocaine especially, there are high chances of oropharyngeal aspiration. Oropharyngeal aspiration. Because the area has become numb, so your local reflexes will be blocked and there are chances of aspiration. That means the food material may go into the respiratory passages instead of the esophagus. But still, these drugs have some role in case of intractable cough. That means a cough which is difficult to handle. So that was about the drugs which are used for cough. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.